addressing health inequities alone is not enough. We also need to make sure that we address the inequities on the social service and on the housing side.
One of the major things that I would like students to take away from their time here and in their medical field is that the primary thing is usually not the primary thing. So if a person's coming in with a gunshot wound, that's not necessarily the primary issue.
Because it's not about what's said, it's about what's unsaid.
Just because you outreach doesn't mean that the services are there. There's actually needs to have services available that are culturally and linguistically relevant services. Having it culturally appropriate is very important because you have to understand that the culture that a lot of people come from, it defines what mental health is, what the symptoms are, what are coping skills, and what does recovery look like defined by the client.
Medicine and healthcare is more than just a prescription and a pill. It's about also going into the community, understanding their needs, and working within the community with other sectors, even outside of healthcare.
Exposure to communities that are marginalized and underserved within our health systems for future providers, or even these students, when you're working in these clinics, you are providers. So there's nothing can beat, having that type of exposure so that you really understand, where these communities are living, where they're coming from, what their living conditions are like, and what their health disparities really are. And they're taking that back to their learning environments, and folks are hearing about that, and then they take that all the way through their careers.
UC Davis is very unique in that we attract really amazing students who are dedicated to social justice and health equity, and this is hopefully the first step in making that into real actionable change.
And it is great to see the nursing students here, undergrad students, the politicians, as you know, Daryl Steinberg was here, our community leaders, all of us working together and figuring out what piece of this do we bring to help.
What kind of healthcare provides the best outcomes? And that kind of healthcare really comes down to working together as a team.
To really provide care for people who need care the most, a lot of us have a lot to learn about what life is like on the other side of a barrier of stigma.
And a lot of that learning is going to come from putting ourselves in these situations, getting outside of school, getting outside of maybe the rotations that we're put in, and seeking out different populations in different environments to really learn what the world we live in is like and how it became the way that it is.
You've got to become an advocate. You've got to get involved in the political system. You have to be insistent on change.
It gives me tremendous hope in our healthcare system going forward that young doctors-to-be are actually focused on trauma-informed practices, because that's where it begins. It begins with knowing what other elements of this problem are going on in this individual's life.